How do viruses cause diarrhea in children? Imagine tiny invaders sneaking into a child's tummy and causing all sorts of trouble. Viruses are microscopic agents that can infect the digestive system, leading to diarrhea. They do this mainly by attacking the cells lining the intestines, which are responsible for absorbing nutrients and fluids. When these cells get damaged, the normal process of digestion gets disrupted, and the intestines start secreting more fluid than usual. This excess fluid then passes through the intestines quickly, resulting in watery diarrhea. The most common viruses that cause diarrhea in children include rotavirus, norovirus, adenovirus, and astrovirus. These viruses usually spread through the fecal-oral route, meaning they are transmitted when a child ingests contaminated food, water, or comes into contact with infected feces. Once inside the gastrointestinal tract, these viruses target the epithelial cells of the small intestine, where most nutrient absorption happens. One way viruses cause diarrhea is by damaging the tiny finger-like projections called villi, especially in the case of rotavirus. When these villi become blunted or flattened, the intestine cannot absorb nutrients and fluids properly. This malabsorption leads to unabsorbed nutrients remaining in the gut, which draws water into the intestines and causes watery stool. Viruses also interfere with the proteins responsible for moving nutrients and electrolytes across the intestinal cells. They can alter the location and function of these transport proteins and break down the tight junctions that hold cells together. When these junctions are compromised, the intestine becomes more permeable, allowing more fluid to leak into the bowel. In addition, some viruses activate the nerves in the gut, increasing the secretion of chemicals like serotonin and speeding up gut movements. This heightened activity causes the intestines to contract more and secrete extra fluid, which contributes to diarrhea. Certain viral proteins, called viriporins, disrupt the balance of ions inside cells, further promoting fluid secretion into the intestinal lumen. The body's immune response to the viral infection also plays a role. The immune system's efforts to fight off the virus can cause inflammation in the intestines, which worsens fluid loss and diarrhea. Rotavirus is especially known for causing severe diarrhea in infants and young children, often accompanied by vomiting and fever. It increases the secretion of electrolytes and decreases the absorption of glucose in the small intestine, leading to dehydration if not managed properly. Vaccination against rotavirus has been very effective in reducing the number and severity of cases. Norovirus and adenovirus can cause similar symptoms but may affect different age groups and vary in how severe the illness becomes. The main concern with viral diarrhea is dehydration, which can be dangerous for young children if not treated promptly. Replacing lost fluids with oral rehydration solutions and maintaining good hygiene and safe water practices are essential in preventing the spread and severity of these infections. In summary, viruses cause diarrhea in children by infecting and damaging the cells lining the intestines, disrupting normal absorption and barrier functions, stimulating increased secretion and motility, and triggering immune responses. These effects lead to excess fluid in the intestines, which manifests as watery diarrhea. Protecting children through vaccination, good hygiene, and access to clean water is the best way to prevent these infections. Always consult healthcare professionals for proper diagnosis and treatment if a child shows signs of severe diarrhea or dehydration.